The practice assignment is what they take home. People have different thoughts about whether to call it practice assignments or homework. Homework can come with some negative connotations for people. I like to say practice assignments. And I like to also be clear with people, you're going to see me for, about 45 to 50 minutes a week for this treatment. In order for this treatment to be useful for you, it is going to require us to do things together in session, but also for you to keep practicing at home. You have had a whole host of experiences in your lifetime, but also based on what you've shared with me about this trauma. And so we cannot expect 50 minutes one time a week to be enough time to practice really using these skills to work through these emotional experiences. And so I'm going to be asking you to do things in between session as well. So for session 1, you'll do the overview, you'll provide some psychoeducation, and then you'll be assigning the impact statement. This is why they think that the trauma occurred, not writing about the specific details of it, but why they think it occurred, and also how it's impacted how they think about themselves, how they think about other people, and how they think about the world. And there's specific prompts around what impacts we're talking about. So how they think about safety, how they think about trust, how they think about power and control, esteem, and also intimacy. And the reason for these specific prompts are because these are areas where later in the treatment, you're going to focus in on a little more. You want to be looking for stuck points as the therapist within these impact statements. So you'd ask the patient to bring the statement to the next session. And that is so that the therapist is able to actually see what the patient wrote, and then also for the patient and therapist together to start to identify those stuck points together. So CPT comes with practice assignment responsibility, but also a lot of handouts, which are very useful as you're talking about different things. So as you're providing information about CPT, the patient will have reference sheets to look at. So what are recovery versus non-recovery symptoms following a trauma? What are stuck points and what stuck points are not? So for the next couple of sessions, when the patient comes back in with the impact statement, you're going to be working on identifying stuck points. So in other words, what are those unhelpful beliefs? At this point, the patient will have a nice kind of overview and understanding of what their belief systems kind of were in terms of like how people understand trauma. And so you're really going to be relying on some of that psychoeducation that you provided in the first session and referencing back to that as well. Okay. Important to say with CPT. So I gave the baseline PCL-5, so that PTSD kind of assessment. That is something to give every session. So there's 2 different versions that you can use of the PCL-5. When you first begin, you want to use the version that asks about symptoms over the past month. And once you are seeing your patient weekly for CPT sessions, which ideally you should be meeting weekly, then you should be given the version that asks about symptoms over the past week. So you're looking at week to week symptom measures. It can also be helpful to make sure that the patient is aware that symptoms can feel kind of intensified before they get better. And there's some metaphors you might use for that or will use for that as part of CPT, as like them sort of being a soda bottle that's been shaken up with the lid on, right? Not processing their emotions. And that once you take that soda bottle top off, what happens? Most patients respond by saying like it explodes, it spills everywhere. In saying that, you're preparing them for that intensity of emotions that they can feel kind of initially, but also talking about the part of the metaphor where the carbonation fizzes out, it kind of dies down. And that's what you're allowing them to do by addressing their trauma as part of this type of trauma-focused treatment. It is important to address when patients do not complete their assignments, because again, that is so important for the success of treatment. So when people don't complete assignments, if they haven't completed their impact statement when they come in, you can say, well, I am going to have you work on your impact statement today. Sometimes you might even choose to end the session early, letting them know like, hey, like you can go and take this time to work on the impact statement. The impact statement is going to be what helps us to identify your stuck points. You want to set the tone early in CPT that you're going to start every session with checking in about the practice assignment, and that the expectation is that the practice assignment is completed, because it is equally important for their recovery as them coming to sessions, right? So if you appropriately prepared people for CPT with the buy-in, this should not come as a surprise, right? Because they've been told there's going to be practice assignments, and that the practice assignments are important for the work. You never want to start a session by kind of skipping the practice assignment, not having time to review it, because it sets the tone that it's not so important. So again, session 2 and 3, you are identifying those stuck points. You are going to introduce that ABC worksheet. So that worksheet helps the patient to track in between sessions, what are the events that are activating me? What do I believe when that happens? What are the consequences of that? And we should be attending to stuck points, how these fit in with stuck points, right? Areas where they really connect to the trauma. So the things around how the patient thinks about safety, how they think about themselves, how they think about other people,